A 65-year-old patient presents with acute decompensated heart failure. Which physical exam finding has the highest specificity for an elevated pulmonary capillary wedge pressure, PCWP? A. Bilateral pitting edema. B. Jugular venous distension, JVD. C. A third heart sound, S3 gallop. D. Pulmonary crackles, RALs. Answer, C. A third heart sound, S3 gallop. Explanation: while JVD and edema are common, the presence of an S3 gallop is highly specific, approximate 90 to 95%. For left ventricular dysfunction and elevated filling pressures in the setting of heart failure. Which of the following is the most common cause of right-sided heart failure? A. Pulmonic stenosis. B. Left-sided heart failure. C. Cor pulmonale. D. Tricuspid regurgitation. Answer, B. Left-sided heart failure. Explanation: although lung disease, cor pulmonale, is a major cause, the most frequent cause of right heart failure is actually left heart failure, due to back pressure into the pulmonary circulation. In the setting of septic shock, what is the preferred first-line vasopressor to achieve a mean arterial pressure, MAP, of JEC 65 mm of mercury? A. Epinephrine. B. Vasopressin. C. Norepinephrine. D. Phenylephrine. Answer, C. Norepinephrine. Explanation: per the Surviving Sepsis Campaign guidelines, norepinephrine is the first-line agent due to its potent alpha-1 and modest beta-1 agonism, providing effective vasoconstriction with less tachycardia than epinephrine. Which EKG finding is most pathognomonic for a massive pulmonary embolism? A. S1Q3T3 pattern. B. Sinus tachycardia. C. Right bundle branch block, RBBB. D. Electrical alternans. Answer, A. S1Q3T3 pattern. Explanation: while sinus tachycardia is the most common finding, the S1Q3T3 pattern, deep S-wave in lead I, Q-wave and inverted T-wave in lead 3, is a classic, though less frequent, sign of acute right heart strain. During mechanical ventilation, increasing which parameter is most effective for improving oxygenation in a patient with ARDS? A. Respiratory rate. B. Tidal volume. C. Positive end expiratory pressure, PEEP. D. Inspiratory flow rate. Answer, C. Positive end expiratory pressure, PEEP. Explanation: in ARDS, PEEP improves oxygenation by recruiting collapsed alveoli and increasing the functional residual capacity, FRC, thereby decreasing interpulmonary shunting. A patient is found to have electrical alternans on an EKG. This is a classic sign of A. Hyperkalemia. B. Large pericardial effusion/tamponade. C. Wolff-Parkinson-White syndrome. D. Ventricular tachycardia. Answer, B. Large pericardial effusion/tamponade. Explanation: electrical alternans, alternating amplitude of QRS complexes, occurs when the heart swings in a large volume of fluid within the pericardial sac. Which medication is contraindicated in a patient with an acute ST elevation myocardial infarction, STEMI, involving the right ventricle? A. Aspirin. B. Heparin. C. Nitroglycerin. D. Clopidogrel. Answer, C. Nitroglycerin. Explanation: right ventricular, RV, infarctions are highly preload dependent. Nitroglycerin causes venodilation and drops preload, which can lead to profound, life-threatening hypotension in these patients. What is the gold standard for diagnosing a pulmonary embolism in a hemodynamically stable patient? A. D-dimer. B. Ventilation/perfusion, V/Q, scan. C. CT angiography, CTPA. D. Chest X-ray. Answer, C. CT angiography, CTPA. Explanation: CTPA is the preferred diagnostic test due to its high sensitivity and specificity. V/Q scans are typically reserved for patients with renal failure or contrast allergies. In a patient with hyperkalemia, which EKG change is usually seen first? A. Loss of P wave. B. Peaked T waves. C. Sine wave pattern. D. Widening of the QRS complex. Answer: B. Peaked T waves. Explanation: peaked, tented, T waves are the earliest sign of hyperkalemia. As potassium levels rise further, the P wave flattens, and eventually, the QRS widens into a sine wave. Which type of shock is characterized by high cardiac output and low systemic vascular resistance, SVR? A. Cardiogenic shock. B. Hypovolemic shock. C. Distributive shock. D. Obstructive shock. Answer: C. Distributive shock. Explanation: distributive shock, such as sepsis or anaphylaxis, involves massive vasodilation, low SVR. To compensate, the heart increases output, leading to a warm shock clinical picture.